Hi, everyone. Thank you so much for having me here today. So my name is Kelsey Amos, and I'm a UVic Master's Public Health candidate. I began my Master's in 2020, so this is like a long time coming, and I'm super excited to be here. I recently completed my practicum with the Public Health Regional Perinatal Team at Island Health under the brilliant supervision of Jenny Nyhoff. And I'll be presenting today on the new BC Family Health Visiting Program, highlighting my role in this broader picture, public health perinatal program change work today. Throughout my practicum, I thought a lot about theory and concepts behind the work I was able to be a part of, and my focus today is sort of a snapshot of how we put that theory into practice. So I want to begin by acknowledging with respect and gratitude that I'm joining today and did my work on my practicum from the unceded traditional and ancestral lands and waters of the Lekwungen speaking and Wisanic peoples. I myself am a mother of two, a daughter, a granddaughter, wife, sister, friend. I'm a Canadian citizenship holding descendant of white European settlers in Turtle Island, and I recognize the privilege I carry as well as the responsibility I hold in working towards equity, actively engaging in anti-racism, and working to deconstruct harmful colonial impacts in health systems that persist today. So, I want to start with what this program is and sort of the why. So we'll call it the BC FHVP for the BC Family Health Visiting Program. What is it and why is it being created? The FHVP is a new BC co-created enhanced family visiting program delivered under Right From the Start, which is Island Health's Universal Perinatal Services Universal Program. It was designed for local families from the prenatal period through early childhood who would benefit from more focused and comprehensive supports, recognizing that this is a critical time for maternal, child, and family well-being, with supports protective of avoidable adverse experiences. The program is relationship and strengths-based, voluntary, flexible, trauma-informed, and grounded in cultural safety and humility. So FHVP replaced a former program called the Nurse Family Partnership, or NFP, in Island Health, building on what worked well in NFP and what we have learned through other national and international programs, while expanding the program's reach and flexibility across the province. Development of the program was collaborative and included PHSA, health authorities, the Ministry of Health, Indigenous partners, and FNHA, community input, and Simon Fraser University. Implementation is phased, so it's like a slow start, and began in early April 2026. So it was a pretty eye-opening and wonderful experience to essentially pull Ministry of Health requirements and policies into actionable steps within Island Health and our region as part of the development and implementation of this program. I was able to support this work across four main areas, so assessing readiness and capacity, supporting workforce planning, developing a program roadmap, and creating transition supports for former NFP nurses and families. So current readiness was top of mind for leadership during the planning stages of FHVP and in anticipation of its phased implementation beginning in April. So I led a readiness assessment with the guidance of my supervisor and public health director, Jackie Hakes. The goal was to assess each public health unit within Island Health's current state readiness and capacity for FHVP implementation. And this was done through a survey of managers, clinical resource nurses, and clinical coordinators with virtual follow-up discussions to share a safe space to discuss and expand on ideas that emerged through the survey. This assessment was collaborative and engagement focused, and we hope to learn as much as possible about the reality of where each health unit was at. Results were focused on health unit level and broader systems rather than individuals. So the assessment outputs included a report, a thematic summary of discussion sessions, and recommendations to support phased implementation. These findings were shared with the regional perinatal team and leadership. and help to inform planning decisions by translating both quantitative and qualitative data into usable, broad-level insights. This was pretty critical in the decision around how the phased approach would look and where we would start. So workforce planning and FTE modeling was a next area of focus in my practicum and in this program development and implementation in Island Health. This involved using PHSA data to estimate anticipated FHVP demand, so new program demand and how many staff members would be needed, incorporating risk factors and social determinants of health, and collecting health unit level data on current enhanced family visiting work. The analysis helped build a clearer picture of current and future staffing needs and supported longer-term program sustainability planning and continues to inform phased implementation planning and funding decisions. To expand on workforce planning was some of the work I was able to be a part of that focused on assessing FHVP supervisory and leadership model possibilities. I listened, collected, and synthesized a wide variety of perspectives that emerged through the readiness assessment and focus groups and within the regional perinatal team through a presentation looking at the possible benefits and drawbacks of regional versus local health unit leadership. While this included many considerations, a primary driver was the discussion around generalist PHN work and the public health nurse work and the impact of competing priorities and the concept of protected time for program fidelity. So this is still being discussed and will be incorporated into decision-making for the leadership model they choose or move towards. Another area of support was developing and contributing to an FHVP program development and implementation roadmap. So the need for clarity during this big transition in communication, in key roles and leads, tasks, and broader categories of work that needed to be completed in alignment with the overall program goals and vision was something that stood out to me throughout this process. This was created through ongoing team discussions and was designed as a living planning document to help align tasks, timelines, and responsibilities. The roadmap and associated project tools supported clarity during a complex transition and helped FHVP to operationally fit within Island Health structures. Lastly, I pivoted in my final weeks of my practicum to some priority work that entailed creating client-facing transitional choice sheets for nurses continuing to support families previously enrolled in NFP. This is one example, one of 4 templates that I made. It was super fun to design some new visually engaging, non-proprietary, easy-to-use materials that nurses could use to connect with families once NFP resources were no longer available. Supporting family continuity, nurse transition, and the relational practice that is foundational in this work. So applying public health concepts, approaches, and best practices learned throughout the MPH in the BC FHVP development and implementation was a really amazing experience for me and really made tangible several of the Public Health Agency of Canada's core competencies. This felt especially relevant to the areas of assessment and analysis, program planning and implementation, and leadership and collaboration, which with each of the examples here representing a core competency that was critical for the change work, required to sunset the NFP program and plan for the future with BC FHVP. So to wrap up, this practicum gave me invaluable insight into how much common theme, relationship building, and communication, clarity, and adaptability are required for successful program implementation. I saw really clearly how interconnected this work is across teams, systems, and communities, and how thoughtful planning ultimately supports the well-being of pregnant people, mothers, babies, and families across our region. I'm incredibly grateful to have been a part of this work. Thank you again for your time today. I'd like to extend heartfelt gratitude to my incredible supervisor, Jenny, the brilliant and dedicated team at the Regional Perinatal Program, Island Health Leadership, and to Mira and the UVic MPH program for allowing this practicum to happen and for making it such a meaningful learning experience. Also, Jill, you are like a queen, and I just couldn't. I'm like seeing in front of me. You're just amazing, and have been such an incredible support all throughout. And Heather, like everyone's so amazing. As well as my sweet, sweet family who's here today for like putting up with me and supporting me throughout these years. So thank you again.